this is a kidney on this side of my spine. My other kidney is supposed to be down adjacent, and this is the mass tumor. So
hi, thank you for coming and talking to me today. Can you tell us a little bit about yourself?
yes, I am Jordan Sessions. I was raised in the Valley up in Eden. I have 4 sisters and I am the second oldest. I went to Weber High and Weber State. I'm married and have 2 kids. We've been married for 14, in January will be 14 years. I have a son who's 12 and a daughter who is almost 6. She'll be 6 in April. So.
Awesome. So we want to talk a little bit today about an experience you had several years ago with some health issues. And can you share with us how you first discovered that you had a medical issue that was serious?
Yes. So going back just really quick into high school, I was a runner. I ran at Weber High and then went on to run at Weber State for a couple years. I walked on and immediately at Weber State struggled health-wise. I had stress fracture after stress fracture, which is kind of like a hairline break in my shins. I got them over and over, and I didn't get to race very much. I was trying to work, I was trying to go to school and earn a scholarship that wasn't there yet, and I kind of hit like a breaking point. They did some bone scans and my bones were deteriorating. They diagnosed me with osteopenia and I was 17 at the time. So that's like the first stages of osteoporosis, and dietitians couldn't figure out why I wasn't absorbing nutrients and what my bones needed. So hindsight, being 17, 18-year-old, wanting to pursue this dream. I've always run since elementary school around the park at recess. That was where I kind of learned to love running. It was just, it kind of defined me at that point. And so over and over I was like repeated, like, running's not for you in my head, like there's something wrong. Dietitians were telling me that there was actually damage being done, that it would be hard to have kids if I continued running at the level that I was. So after a lot of me ignoring what I knew was reality and what needed to happen, I had a pretty profound experience that actually happened in the Ogden Temple. I'd gone early to do baptisms and was just struggling with that decision. And years down the road now, I understand how important it was that I needed to be done with that intensity level. But I opened to Proverbs and read the scriptures that basically say, lean not on your own understanding. Acknowledge that, Heavenly Father is trying to help us all. And the promise after that scripture is that it will be strength to thy navel and marrow to thy bones, which is literally what my body was not doing, was maintaining the bone marrow that I needed to be able to have healthy bones. I did the baptisms, left that day, went straight to my coach's office and quit Weber State. So now fast forward, all those years I always had back pain. I had back pain through high school, off and on, and we would deal with it, we'd stretch, and I'm a runner, so your hips are tight, there was always an answer. And I got married and had Deacon, my son, in 2008, and we struggled to get pregnant after that, and I had a miscarriage, and my body wasn't supporting pregnancies, and I wasn't able to get pregnant. which I was taking back to maybe the damage I had done in college. But we were able to get pregnant, and in 2015, in April 2015, my daughter was born. And again, there was severe back pain through the pregnancy, but again, that was all very normal. You get sciatic numbness in your leg, and everyone who's had a baby understands that back pain and everything is very normal. Her delivery went really fast, and we were home for 2 or 3 months actually, and I'm still having the numbness in my leg. I'm still having the pain in my back, and weird stomach pains. Like it was all just compiling, and I couldn't match them to anything. And I had been to see my family doctor a couple times, and we were troubleshooting and working through it, and finally, I'm trying to think, it was probably September, I woke up with just severe stomach pain in the middle of the night, just like shooting pain. And I woke my husband up, and I just said, I've got to go back. I thought I was crazy. I said, I got to go back. I don't know what it is.
Back to the hospital?
Yeah, back to my family doctor.
Oh, okay.
And I went back in, and I explained the sharp stomach pain, and he said, I have no idea how it could be tied to your back, and I still understand your numbness in your leg, but let's just check your gallbladder. I mean, the sharp pains, he said maybe there's gallstones. So I had an ultrasound that day, and the ultrasound tech's face was just, I mean, I knew something was wrong. Mm-hmm. And she said, if you don't get a call back from your doctor in a couple hours, you need to call his office. So I went home, got a call from their office, and basically they said, you need to come back after 5 o'clock, and you need to bring your husband. And I went in, we sat down and waited till all of his patients were gone, and he came in and just showed us the images he had, which were only ultrasound, which now I understand a lot more medical things more than I care to know, but it was very vague. But he just could show the mass that they had found. They found a tumor attached to my psoas muscle, which is along the spine in kind of like your lower abdomen. And he said, we have to have a CT scan. He said, I don't know what the plan is, but he just said, this is like large. He said, I would not be surprised if you're down at the U within the week to deal with this or to have it removed. And he said, let's wait till the CT scans come in, but I'll call you tonight with the results. And I think from that point until even way after the phone call that night, it was just like a dream. Like nothing felt real. I know one of the questions you wanted me to answer was like the feelings, and it was really just surreal, like not real. This didn't feel real. He called back that night. We went and sat at the hospital. We went straight there and did the CT scans. I have the little order from Dr. Richardson, the stat, order still in my journal that day that we took to the hospital. He called us that night, and my parents were in town. They lived out of state at the time. They still live out of state, but they were here visiting, and so they, of course, after I said I have to take Steve and we have to go in, and we knew it was serious, they kept the kids that whole day, and we went back to where they were staying at my grandma's house in Pleasant View and waited for the phone call. And then when it came, Steve and I went outside, and he gave me the diagnosis from the radiologist, which was a very dangerous type of fast-growing cancerous tumor. And immediately said that the next day the plan was to do more scans to see if things had spread. They wanted to check my lungs and other organs, and just kind of started to make a plan. But still, even then, just felt so like a dream. And I remember the only thing I really wanted to do was go. I wanted to take my kids and go home. Maybe fall asleep thinking that it would all go away. And again, my son was he was 7, and Ellie was just 4 months old. And so having a baby, I think, was the best distraction for the next year that we dealt with it. But that's what I just wanted. I wanted to take him and go home and try and have a normal night. I went home, and my parents had been in town, and they said, going back to my upbringing, and phenomenal parents, and my dad's business is here, but they had moved away, and at the time they had a lot of things going on. They had callings, they had other things, and my mom said, we're going to go home for 2 days, we're going to get everything in order, we're coming back down. And I want to say it was a Friday or Saturday we found out with the initial diagnosis, and that night I went home, tried to sleep. By 4:30 in the morning, I was like, forget it, I'm not sleeping. I was still in a lot of pain. And I got up and I went for a walk. And I remember it was like, I must have been a full moon, because I didn't need a flashlight, and I just needed to try and clear my head, because my falling asleep and having it be a dream was not going to work. And I sat down on a bench, and I remember just, it almost was like I was going through like so many things, trying to figure out how to tell my kids. We hadn't really told Deacon, we didn't understand, I didn't explain anything to him, and there was just so many things going through my head. And I remember looking up at the stars and the moon, and I just said, I have jobs to do, I have things I gotta do. And I'm not going to be able to do it if I can't have support, and if I can't trust that it's going to be okay. And I said, please, let me stay here and raise my kids, and let me have the opportunity to prove that I'm gonna make it through this tough thing that was coming. And overwhelming peace. Just, it still felt like a dream. So like terror, horror, none of that was there, but it was just overwhelming peace. And I remember getting up, feeling so good. I walked back. I still didn't sleep, but I felt so much better. And the process continued through there. We went and met with multiple doctors. One of the head cancer doctors down at the U was who we met with first, and she just said, I can't do this, it's too vascular. I actually brought this just to help kind of show, and maybe you'll be able to see it, maybe you won't, but so this is her actually original scribble on the CT scan that they did. So my stomach is here, my spleen. This is a kidney on this side of my spine. My other kidney is supposed to be down adjacent, and this is the mass tumor. So one of my long-term effects, and I'll go into that later, is that my right psoas muscle is completely gone. This is my left psoas muscle, and as you can see, the tumor had taken over it completely. And the pain probably that I was feeling was my kidney and my gallbladder that should be there but was pushed to the back, was just, everything was out of place. But they had to deal with the vascular side of the tumor. So it was very, very vascular, which means that there was a lot of blood pumping through it. It was kind of like a heart. It had blood vessels and veins, and just, there was a blood lake in there that was like the size of a golf ball. So they knew biopsying and removal was not an option. And so to summarize the 9 months from the time we found it to the time that they removed the tumor, I had 5 angiograms, which it was really funny. Every time I'd show up for one of those, the nurses were shocked, because usually they're for 60, 70, 80-year-olds. And so sitting in those waiting rooms was super weird. And you're awake for those. So for hours I would lay on this table, and they go up through one of your main arteries, and they would glue and try and seal off the blood supply out to the tumor, because they were trying to shrink it and make it as safe as possible to remove. For the 9 months, no one would biopsy it till the very end because it was too dangerous, because of the bleeding risk. And so for a lot of months we had this diagnosis that it was cancerous, and that it was, I mean, it was dangerous, cancerous or not, but previous to us finding the tumor, I am not a patient person by nature. And I had prayed, that was kind of one of my vices, that I was like, I really need to work on it, I need patience, and we get what we pray for, because I'm not going to tell you that I'm very patient and perfect now, but having to wait 9 months for something like that was extreme. And if I could go back and be who I was and feel the feelings that I had then, I would do it in a second. I would go through something like that again. Because the closeness I felt to my Savior, because I needed Him, and the patience that I had and the peace we had in our home was unmatched. I've never experienced anything like that. And I like to think that I learned a lot and that I've changed a lot patience-wise. But it was, the feelings then, as hard as they were and as bad as the struggle was sometimes, I wouldn't trade it, and I would go back in a second. I'm getting really sidetracked, so my notes are everywhere. But so I had to do 5 angiograms, and some of the tender mercies throughout this whole thing, I can go back and tell, we could talk for hours, but Ellie's delivery was really fast. My regular OB, who was supposed to deliver, had just gone into surgery. He had been in to check on me, and then he went into surgery. So his doctor who filled in for him came in, and I pushed twice, and she was there. And going into those angiograms, almost 6 months later, no one could believe that I had a baby, that the tumor didn't burst, that a blood vessel didn't burst during pregnancy or delivery. One of the texts was like, you having this inside you should have never been able to have kids and survive. So as hard as it was to get pregnant and have 2 kids, not every child that's born is a miracle. But understanding more and more as I was going on, the things that never should have happened or shouldn't have worked out like they did. The night we went in, when I went into labor with Ellie, I wasn't dilating and I wasn't progressing, but like I was in pain. I was obviously having back pain from the tumor, but I was so scared I didn't want to go home. And I looked at this nurse after they'd send me on walks. The doctor will let you stay for another hour. I would walk circles and circles. I was doing lunges on the backside. I was doing high knees where the nurses couldn't see, so I could progress the labor, because I was so scared for them to send me home. And this cute nurse came in. She said, it's the end of my shift and your hours are up. And she just probably saw how terrified I was to go home. And she broke my water and she said, take that to the grave. I will let the doctor know that your water just broke.
Oh, wow.
And I don't know who that nurse is. She left and another nurse came in and took over, but I don't know what would have happened. Had she not broken my water, maybe I wouldn't have progressed. I would have gone home. Something scary could have happened. My labor could have been a lot longer, which would have put pressure on the blood circulating through that tumor. So, and I have story after story of the tender mercies like that. But that is one that I will never forget, because do we really know what would happen? No. But I had a really fast delivery and maybe wouldn't have otherwise. And I didn't realize that till I'm sitting in the angiograms and the techs are, just trying to do small talk, and I'm telling them I have kids, and they're like, there is no way. So they were able to, through that process, they were able to shrink the tumors. We went through so many different doctors till we found the surgeon. I wouldn't feel good about a doctor, or we didn't like the plan of a doctor, and we'd go back to our family doctor, and I forever am grateful for him too, because he was so patient and worked with us and said, it's fine, we'll find another doctor. And we did. We found a surgeon who we felt really good about, and she had an interventional radiologist who ended up doing the all of the angiograms and was with us through and through all of the process. And lots of little miracles happened all along the way. To go back and recount all the little blessings would be really hard. But that little Ellie one is huge for me, because the delivery could have gone really south had it been a long labor. My parents were in a position, they lived out of state, but they came to Utah. They moved us and themselves into their rental property over in North Ogden. And Steve was able to continue to go to work every single day, no matter what was going on with me, through all the big surgeries and all of the angiograms and all the appointments. He was always there, but my mom and dad basically moved in, and they filled all the holes. So he went to work every day. He needed to be there. At the time, Deacon we had decided to homeschool right before all of this happened, and my mom took on the homeschool. She took on the syllabuses I had come up with, and she not only taught him school, but got him ready to be baptized. They read the entire Book of Mormon through that school year. And my dad and Ellie became the best of friends. And there were weeks and weeks at a time where I was not even supposed to pick up that much weight. And so I was at home in a lot of pain, recovering from those things, and just getting to sit back and watch my kids being raised the way I would raise them, being taken care of and loved the way I would. It was really, I talked about it being like a dream. There were still lots of parts of it that felt like that. We had incredible neighbors. We had an incredible ward system. I got a blessing from the stake president at the time, and it's always hard to hear the words that you are okay with what the Lord's will be, but that was also very peaceful and reassuring time for me to have that blessing, and to have him talk about the blessings that would come and the answers that would come. And one of my biggest concerns was my son's education at the time, because I had worked so hard at a private school to get him the education he deserved and I wanted him to have, and I knew that that was going to not happen this year. And President Keller told me, which now in what we're living in COVID 2020 is incredible, that he told me clear back in 2015, but he said the most important things your kids will ever learn will be from your lap. And as concerned as I was about education and what he would be missing, all of that fell away. And now in this crazy year, after he's been in public school and done fine and found things he loves to learn and loves to do, we're homeschooling again. And homeschooling, regular schooling, teaching about the gospel, it's all changed drastically because of what he told me and the emphasis he put on that being a mom and being the one teaching them, that they'll learn, the most important things they'll ever learn will be from your lap in your home. Steve and my parents were, I've probably never really asked them, but they were so positive the whole time. I remember having maybe 4 or 5 really big, deep, dark meltdowns where it was just no answers. We couldn't find the right doctor, and it would get really frustrating, and literally just the anxiety and depression would just kind of come crashing in. And I never once felt that from them, saw it from them, and I came right out of it because of the way they were handling it. They were being so careful around me, and I I know Steve, everyone who knows Steve knows that he's goofy and can keep almost anything light, and that's what he did the whole time. And I know that that's not what he felt, and that's not what was going through his head, but he did it for me. So that is how I survived, to be honest, was the support system. Not because I'm tough, that's not it, but the people around me were really tough. And we would get texts from friends in the ward, and they would come pick up the kids, and I would say, it's okay, my parents are here, and they say, it doesn't matter, we're coming to get them. And they would play with the kids and let them go away from still the happy place we were, but distract them from what was really going on. So we were really incredibly blessed with amazing people, and that's how I survived. The main reason I think that I was able to stay calm and to be at peace most of the time was being able to go to the temple. And I remember most of the time we could go and we could do temple work, and my dad is really, really good at finding stacks and stacks of history, so we would always have things to do. But a couple times I was in so much pain that I knew I needed to go to the temple, I needed to be there, and I wanted to be there, but I wasn't going to be able to go through do any of the work. And so there were times we were able to go talk and meet with the temple president, and we didn't have to do the ordinances, but we could go and just sit in the temple, which was really important to me. And the quiet peace and calm that anyone has been there understands, that those were the moments that would get me through the next couple weeks, the next surgeries. Having the prayer roll was really important. I knew a lot of my doctors were not, didn't have the same beliefs that I did, but it was important that their names were on there, because they were doing, any of the surgeons that worked with me told me it was all an experiment. The oncologist told me, anyone who tells you they've done this surgery or knows what they're doing or understands exactly what they're doing would not be telling you the truth. She had called the Mayo Clinic and sent my information there, and they basically replied that I could go there, but that they didn't have answers. They would be experimenting just like her. So that was the piece that I could find. The way that I coped was definitely the temple, and the people around me. Those were the two biggest things. Also, hindsight, like now I am five years later, I don't think I understood what it was really doing to me mentally to have to go through that, but I didn't know what anxiety was. I didn't know what real depression was, and I do now. Not because I experienced it so much then, but just kind of the wear and tear that it has had on my psyche. I do struggle with some anxiety now, and have good friends and family that know all about it, so they're helpful. But the temple was definitely my place of peace, and I had to go there even when I knew I couldn't last more than 20 minutes sitting in there. That's just where I needed to be. And I am and always have been grateful for the temple. So
Can I ask you,
yes.
What do you do now that we can't go in there?
That has been really difficult. Can I tell you a really funny quick story?
Sure.
I was in Deseret Book last week, and I saw a couple come in there in dress clothes, and I just, for the life of me, tried to not get jealous because I knew they had probably been doing temple work. I've always tried to keep my home as close to the temple as possible, and not being able to go has been really hard. But getting to do some of the other really important things that we can do in our homes right now, having the sacrament in our home, and having the kind of the sacred level of our home increased, has obviously not replaced the temple, but it's helped a lot. And getting to spend more time with our family. We're just together more, so that's helped a lot too. But I am waiting and watching for the temple to open, and I am very happy. I have a cousin who was sealed last week, and my dad works in the Star Valley Temple, and so just knowing that it's not completely closed anymore is really helpful. And getting to read stories. My mom and dad have started once a month telling ancestor stories, and it's fun. We get on FaceTime and all the kids gather around their computers, and you can see them all on the little screens, all the cousins, and they just do they each share a quick little story of an ancestor, whether it's a close grandpa or a way distant ancestor. They've told stories, and so trying to stay on top of some of the family history and teach our kids how important that is has helped a lot. So just another miracle / tender mercy that happened after one of the angiograms. I started to have a lot of pain, kind of in my really low abdomen and near the site where they would go into the artery. And I had called down to the Instacare. I didn't know exactly what to do. Literally, I had every surgeon's cell phone number in my phone, which I'm sure is not normal. But Steve took me down to the Instacare. That was one of the dark times. I was just in tears. I was told by a lot of the doctors that I have a high pain tolerance, which is funny because I pass out with pain. So I'm not sure how tolerant I am, but I was in a lot of pain that day. And we went to the Instacare. The doctor did an ultrasound, and he said, we have found a blood clot in your artery, and we're not exactly sure what to do because the answer is put you on blood thinner. But because of your tumor, which is very dangerous, bleeding risk, we cannot do that. And they called my IR, who had done the angiograms, who was on a vacation at the time. In all of this, I have an incredible appreciation for the medical field and people who do things that I still don't understand. But the people that worked with me will forever be my friends. I still get to go see the surgeon, the main surgeon who did the surgery, and she and I keep in contact still. Sorry, here's my sidetrackness. So back, I'm in the Instacare, and the doctor said I can't let you leave. Like, the blood clot's dangerous, but it's dangerous to solve it. And the interventional radiologist from IMED down in Murray, who he was talking to on the phone, said, I've got my colleagues at McKay ready for you. We're going to have to put in a DTV filter immediately because we can't thin the blood. They had to put in the filter so that if the clot dislodged, that it would get caught in the filter. And I think when I could prepare for things, I was okay. When I knew an angiogram was coming and I had a week to think about it and process it and pray about it and be ready, I was okay. But that was really scary for me. We went to McKay, bypassed everything, and went right into surgery. And there were times when I was alone. A lot of the time I was sitting on a hospital bed with a hairnet waiting in a hallway, and nurses are passing, and I'm waiting to go into a surgery room, or I'm waiting for a procedure. And they were really kind of quiet, calm times, but it's when I could sense that I was having anxiety, that I was nervous. I was always okay when I was in the room with my family, and as soon as the doctor's there, I was okay, but being alone was kind of unnerving for me for some reason. And I would sit and I would, in my mind, play the primary song. I would repeat in my mind over and over, Heavenly Father, are you really there? And I would ask, because we're told in the scriptures to ask. And by the time I was done with the burst, every time I was okay. Whether I still had to sit there for 20 more minutes by myself or somebody came to take me right into the room, I was okay. So I still use that, and I'm not going through scary things necessarily all the time, but that was kind of my saving grace, was to take the challenge in the scriptures to ask and to wait and then get an answer. And I did that a lot. Scans were always scary. I think I've had 6 or 7 CT scans now at this point in the process, and laying in the scan rooms or waiting was always scary. I also have 2 incredibly amazing grandpas who have both passed away, and I remember they were scanning everything else to make sure that nothing had spread to my lungs or to my brain. And waiting for those were always scary because, again, it was the unknown. It wasn't planned. I didn't have time to process it. And I never saw them and I never heard anything, but I always, through a lot of the scans, knew that one of my grandpas was there. And not being alone. Sorry, not being alone was how I was able to cope. So it was always the people that were physically there, like I said, Steve and my family and my neighbors and my friends, and then times when I had to be alone, I still was never alone. And I think that that's why the temple was so important at the time, and why family history is important and the temple is important now for me, because of those reasons. So they put in the DVT filter, and I went home and recovered from that little surgery, and that was another little miracle, because I could have pushed aside the pain. I could have said that it was something else. People ask me all the time, like, how did you know? I think people have aches and pains all the time. How did you know that you needed to take it serious? And I honestly didn't. I just felt at those certain points when I went in for those regular appointments with my doctor that I needed to keep going, or I'd go for a couple weeks after an appointment and then I would have more severe pain, and then I knew I needed to go in again. And it was the same thing. I didn't think that anyone was going to find anything. I didn't think that there was an answer. I just knew that I was in pain and that I felt that I needed to go in. And that is something I try and teach my kids, that we learn from listening. We learn from listening to the Holy Ghost, and those were huge tender mercies that I was able to be, even in the midst of the fear and the pain and a lot of the time the tears, still be able to be guided.
What's your prognosis now? What do they tell you? And how do you move forward in a positive light and not sink back into
Not
the
just
fear?
let it hang over me. So now my diagnosis, just to summarize the medical part. After they got the blood under control, the intervention radiologist, who I love dearly, said, I think that I feel confident enough we can do a biopsy. So this was really just weeks before the surgery anyway. We'd waited 9 months under this diagnosis that it was cancer. And he did a biopsy, and he was only able to do a really small portion, but he said everything that we got is benign. So that was huge news. Just like all the really good news we'd had all along, that nothing was in my lungs, they didn't find anything in my brain, that it was isolated to just the tumor that was there. So after he did that, they made the plan. It took us months to find a neurosurgeon willing to help, because the nerves that had grown into the tumor were mostly sensory nerves, which are not a big deal in comparison to a motor nerve. We actually sent my case to quite a few neurosurgeons and were turned down to find a neurosurgeon that would come help the oncologist do the surgery. And she was searching, we were searching, we were praying to find somebody because she couldn't do it herself. And we went and met with a really young doctor out in Salt Lake, and he was willing to do it. He'd only been practicing for a couple years. And what he was going to do was going to fire the nerves, so they could see what nerves were, where they were cutting, and they could cut around the motor nerves, and they weren't as worried about sensory nerves. If I had to be numb in places, that was fine, because they still weren't positive that it was benign all the way, and they were trying to get as much as possible. But obviously, so one of the biggest risks is if they cut a motor nerve, then paralysis and body parts that weren't going to function. So we found him, they met and discussed the surgery, and on April 1st of 2016, I went in, and it took him 8 hours, and she actually nicked the artery twice, so I think during the surgery I had 3 transfusions, and then in the ICU I had another one. But all in all, they cut 1 sensory nerve, so I'm completely numb from my hip to my knee. Like, for instance, if my daughter comes to get my attention, if she's touching that leg and I'm not looking, I don't know, I can't feel that. That's kind of a run-on joke with the kids and Steve, and Steve's like, well, I wonder if we put, you know, our hot chocolate on Mom's leg. Anyway, so they were able to get a large percent, over 80% of the tumor, but because of the bleeding risk and because she'd hit the artery, they left parts of it. They biopsied the entire thing, and it was benign. It's technically a hemangioma, which is like a growth of, it's usually on the surface of skin, so it's usually seen. It's usually like a dark red gathering of blood vessels, but mine was just very large. They thought that it had been growing since tiny child, which explains a lot of the back pain my whole life. And overall, after the surgery, it was huge blessings. I mean, the fact that the transfusions were successful, the fact that I obviously was really weak and wasn't walking normal and all of that, but none of the motor nerves were injured or damaged, and so that was all going to be okay. And they had put in metal coils, so I do have titanium coils in the remaining part of the tumor that's right next to my spine, but the psoas muscle is completely gone. So I don't know if you can see the before and after. So this big white glare, they call it, is the metal coils that are still kind of just the remaining of the tumor, and then what they use to cut off the blood supply. But here's my psoas muscle on the left side, and then the right side, you can see that it's just gone. So, and my kidney's back to where it needs to go. But basically, what I was left with is the psoas muscle is the muscle that picks up your leg in walking, running motions. And because I had been a runner and I had been doing it my whole life, and the tumor had also been growing, it was slowly taking over that muscle. But the minor psoas muscle and the other muscles that are there had kind of been trained to deal with that problem. So I don't have full mobility. I can't run as fast as I could have. I can't run uphill is really difficult. So for me, being a runner my whole life, being told that like life is going to change is okay because of what I still can do compared to what the option was otherwise. The surgery not being successful and a lot of other things that could have happened. So moving forward, I have numbness in part of my leg, and when we do like a lot of adventuring in our family. So Steve has taught us how to rock climb, and I always loved hiking and camping as a kid, and Steve's introduced mountaineering. And that fall, he really wanted to summit the Grand Teton, and I remember thinking, you're crazy, because he wanted me to go with him. There are sections of rock climbing where you rope up and you're belayed. It was really intense. There's something called the belly roll, and you have 2,000 feet of exposure, and I'm just not that kind of rock climber, but I knew I needed something big to kind of like kick off the rest of life after, just kind of, I don't know, that's it, kicking off the rest of life, because I'd gone through something so crazy, and so we decided to do it. We kind of started training for it, and I was familiar enough with rock climbing that it was fine. But I won't go into that, but it was just as much of a spiritual experience as it was physical to do that for a lot of reasons, and it was choosing. I'll never forget, we camped and we'd hiked in our stuff, we had weight on our backpacks, and it would get steep enough that my leg only will go so far, and then I literally have to pick it up with my two hands to get it to the level where I can keep going. And I remember going to bed, Steve will tell you, I cried every night. And I was like, I'll just wait here, you go finish, come back, and I'll just read a book. I don't like to read, but I'll find something to do. And every night he was just as calm and funny as he normally was, and got me to go to sleep. But when we were standing on the top, we just kind of, we had met some people along the way, and we were taking pictures, and Steve was walking to all the edges trying to see as far as he could, making me nervous. And I remember just being so excited that for the first time in like a year and a half of the craziness, I was able to choose something hard physically, mentally, emotionally, instead of having to do it. And I don't know if that makes sense, but had Steve not made me do that, I don't know where I would have been spiritually, mentally, and emotionally. I think I was fine. I would like to say that I was fine, but I needed that kind of push to everything's gonna be okay, and it's okay to choose hard things still, and to physically put my body through something that I wasn't sure I was gonna be able to do. Even tumor aside, it was really difficult, but it was kind of what I needed, and to ask for support for something that wasn't life or death, but I still wanted to do, to kind of ask for that from a Father in heaven who loves me just as much for that as he does for a life or death situation also. So how I cope now, I still do have a lot of pain, and I have good friends. I have a friend who's an ER doctor, and the entire time, the whole year, any new scans I got, he would say, send them to me please. And he was back east in Philadelphia, and he would show them to the specialist there, and I got free second opinions and free support from him. And I have friends who are in the physical therapy world that are trying to help me recoup the muscles that are deteriorating and not working right, and the trigger reactions because of my offset. So there are things that I still have to deal with, but honestly, I can attribute it to the people that are around me. And as odd as it is, the Teton trip I had to prove to myself that yes, we've overcome it and it's going to get better, but there's still going to be hard, and there always is. So I was just blessed with good people around me, good family, and obviously, I guess it's not obvious to some people, but the song Peace in Christ in my life came probably a couple of years too late, but it's fine because I need reminders now just as much as I did then that true peace really does come through Christ and doing His will. So, but the people around me, my family now, still dealing with anxiety, which I think I never knew what it was. I never had been through it, and then going through it, I now realize it and recognize it in my life. That peace that I need is from Christ and my family, and from the eternal truths that I know. Anxiety is something that I'm still learning how to deal with and cope with, and I was always kind of the abrasive, tough sister in my family, and if you asked any of them, our punishment was to, we lived on 4 acres, and when we'd fought, we had to hold hands and walk to the top of our property and touch the top of the fence. Sometimes we had to stay till my mom died so we could go back, and the joke is that it was always Jordan and someone was walking to the top of the field. So personality-wise, kind of who I am has changed even. I still say what I feel, and I still run my mouth sometimes, but I think that experience has changed some of my personality like that drastically. To be more patient, to be more kind, to be a little more understanding, and to deal with the anxiety and to be more compassionate towards others, because everybody has something that they're going through at all times. So, but for sure my family, Steve, Deacon, and Ellie are who I spend my time with, and we keep doing what we need to as a family to try and be together, and going on adventures to remind ourselves that life's short and it's not worth worrying about the small things. So